Hello, beautiful people. Welcome again to Masters in Action. I'm so happy to be with you again. I've been trying to be more consistent with the podcast. So once every month, you'll get great content, nice interviews with founders, with tech founders that have come all the way here to share their story, their knowledge about building a digital product. So, as you know, this podcast is meant to provide you with great stories about founders that actually have done the thing, that have created their app, their software, and the struggle and the challenges that they have overcome to launch this product. So I'm so glad to be with you. We share also, we don't sugarcoat, we share everything from the good, the bad, and the amazing. So stay tuned. I have a guest coming up that I'm sure you'll enjoy learning about. Sponsors for today are UX by Mia, and I want to share the UX class that we will be launching again. So this class has been going on for a few weeks now, and it's been such a success. People are enjoying it, and I want you to be a part of it. It's UX Advantage, and basically, this is a 4 weeks program providing you all the details that you need to know about your user and how to approach UX design in a contextual way, and really in a when it comes to business, how you can actually solve your business needs but without compromising on your user experience. So we've worked with startup, we work with founders and organization that have very lengthy and heavy processes, complex processes that wish to include more of their users feedback in these processes. So if you're struggling with adoption, product adoption, you're struggling with your users utilizing your product, or it could also be that you are currently as a founder building your own digital product and you need guidance on how this is actually valuable to the people that you want to sell this product to. So basically is how you grow revenue with user adoption. And this is what I'm showing you in this class. We go deep into users' behaviors and how do they navigate through your platform? How do they understand and they trust your product? You get to build also a community, be a part of a community of founders just like you that have these concern, these questions, and it's just amazing to see the dynamic and these courses. So make sure you register. I'll link everything and the box below. So let's go back to the video and hear about Danneelle Crisp. And today I'm so excited because I'm receiving Danneelle Crisp. She's the CEO and founder of ElleLogic AI, which is a Montreal-based company that transforming emergency care through AI. So her platform helps hospital actually streamline triage, reduce wait time, and support clinician with faster decision making through data-driven information. So overall, she's improving patient outcome and easing pressure on the frontline healthcare providers. So I'm so happy to have her with me today. I'm sure she's going to share great knowledge. So she is, as I mentioned, the founder and the CEO of ElleLogic AI. Welcome, Danielle.
Thank you for having me.
My pleasure. I'm so happy that you said yes to the invite because I was just like, I need to speak with her. You have so much knowledge, so much insight to share with my audience today. And yeah, I can wait for us to get on it.
Thank you for inviting me. So
My
go ahead.
pleasure.
Yes.
So let's start with how are you today?
I'm well today. It's a
Yes.
very amazing day. Yet
Oh,
to
it's
have
beautiful.
breakfast, but still
Okay, we can manage that after the podcast.
100%.
You mentioned that you just came back from Web Summit,
Yes.
Vancouver. How was the experience?
It was amazing. If you've been to Web Summit, they're amazing companies. I have to say there's a lot of AI this year,
Mm.
but amazing network to be had and amazing people to be met. It was an experience.
Okay, great.
Yes.
Now, Web Summit, you better sponsor me next time. I'm giving you, I'm giving you free publicity. So, Danielle, you obviously here to talk about ElleLogic AI. This is a company that you founded a year ago,
Mhm.
and I'm so impressed with the work that you've done so far. Just the visibility that you're getting right now, because this was definitely needed, and the healthcare industry definitely
Yes.
needed, but also I think people understand that there's a lot of pain points that patients are having through the medical system. So first I would like you to share, how did you started ElleLogic AI?
I have to say, before I started ElleLogic AI, there's been many companies that have tried it.
Mm-hmm.
Some were more successful than others. But for me, the Really, motivation that I got was from my best friend's mom that went to the ER.
Mm.
She moved here from Ontario. She's an elderly lady. She had a history of stroke, and she went to the ER here in Montreal with chest pains.
Mm.
She waited over 6 hours, didn't see anyone. Then she saw a nurse that says, "Oh, you only have heartburns. Go home and sleep
Oh
it
my
off."
God.
Barely 5 minutes upon arriving back home, she died of a heart attack.
5 minutes.
Barely 5 minutes.
Oh, wow. That's insane.
Yes. And I would like to say that's the driving factor, even though that was a traumatizing experience for my best friend, being there for them
Yeah.
and seeing what I can do. Their mom died for something that could have been helped. They did not check her vitals, they did not do follow ups, they did not have her history. And that's a pain point everyone has, right? And sitting with that grief, seeing my
Mm.
best friend in pain, I'm the type of person that thinks, what is the issue here?
Yeah,
Right? If she wasn't the only one that experienced this,
absolutely.
a lot of people have died in the ER in Canada, globally. It's a tremendous problem we're all facing here.
Hmm.
And I was in my EMBA class and we're talking about servant leadership and what that looks like in different level of government, in health authorities, in politics and everything. And healthcare came up and we are discussing what it looks like in different level of healthcare, from nurses to physicians, doctors, directors of ED, CEOs, where that visibility lies, right? Where that disconnect is, where the information that they need that they aren't getting. And that combined with the history of my best friend's mom
Hmm.
is a driving factor of why not make a difference, because I believe if I want a difference, it starts with me.
Absolutely. But the fact that you have no background in healthcare whatsoever is quite impressive.
Yes.
So, so how did you get the confidence to actually tackle this industry, which is a huge industry with so many? So as you mentioned, it's also paper based
Yeah.
industry, so it's very bureaucratic and like someone that is has no background in healthcare. How did you find the confidence to be like, you know what, I am gonna be the solution?
Well, I have to say, confidence is a habit. It's not something you wake up and feel confident. After a time of
Mm-hmm.
motivating yourself and doing research, getting that knowledge and asking people, getting information, admitting that you do not know the what's happening, and then learning from that. That's
Mm-hmm.
how I built confidence. Is repetition, is going out there and being curious, seeking answers, asking the hard questions, and having the difficult conversations. And that's how I started building ElleLogic. We always started with the clinicians first. We always start with the hospital in mind, with the main users of our software, which is patients, clinicians, and doctors. Where's that disconnect and how can I do
Mm-hmm.
better?
I love that. I love that you seek for knowledge first, not knowing the industry. Obviously, you didn't jump in and just pretending to know everything. And what was the reaction of clinician, doctors, and hospital when you approached them with that project?
Frustration.
Okay.
Definitely frustrated with the system we have
Frustrated
now.
about what?
The system we have, a lot of
Mm.
people want to provide a solution, but
Mm-hmm.
it's a point solution that they solve one thing but create three other problems, right? With ElleLogic, we want to solve one thing without creating three other problems, without creating an extra step, an
Mm-hmm.
extra level for the clinician, additional work they have to do. We want to integrate seamlessly and be a driving force to reducing their workload and
Mm-hmm.
supporting them, not creating more chaos, right? So immediately when I talk about ElleLogic, they have frustration on the health system in general, the care they're getting as the clinician, because they have the brunt of it all. They're the one with the patients. They're the one seeing the wait time. They're the one being emotionally drained. They're the one getting burnt out. So initially they have frustration. And when we open that conversation, we dive deeper in that frustration. We then get to the root cause of it all, right? How can I support you? What support do you need? What does that look like for you?
Mm-hmm.
And I always ask them, I ask this to everyone most of the time when I remember, that is,
Mm-hmm.
um, what are you trying to explain to me that I'm not
Yeah.
understanding?
Very, very important question.
Right? To
Mm-hmm.
make sure not only you're communicating it to me well, but I'm grasping every detail you're telling me so that I can go back and put it into my solution. And once I've developed it with your comments, I then come back for you for feedback. Come test it with us. Let us know your feedback. Does it actually work for the hospital you work in? And not only that, I do the same thing with ED directors, with physicians, with doctors, because we believe we want, we understand it's not one size fits all,
Absolutely.
but for each hospital, they have one system. I want to understand that fully. What do you need to see in your line of work, and how can we provide that to you seamlessly?
Absolutely. And they all, as you mentioned, they all have different needs.
Yes.
So on. We discussed that earlier. The patient as a particular need, the clinician has one, the hospital as a need as well. And how do you manage to make all of them happy with one solution?
Yes. So I have to say, our goal with ElleLogic really, I understand you have to appease the customers, but our goal is not make them happy. Our goal is to functionality and efficiency. And we have multiple dashboards for this. So we understand what you need for an ER to operate effectively. And the goal is to provide better patient care, reduce ER, and support clinicians. We believe clinicians are the heart of the hospital.
Absolutely.
Right? So with the clinicians, we know they want point of facts immediately. They want to know medical history, want to know your vital signs, they want to know why you're here, your symptoms, your medical history. Doctors, they want to know what medications you're taking, lifestyle, and more in-depth information, what you've done last week, doctors you've seen before. And then the EDs want to see, okay, what does the ED look like? How many people we have waiting? How many nurses we have? Are we short staffed? What's happening? Right? We want more analysis of this health of the ED. CEOs or chief of the hospitals, they want to see, okay, what the health of the ER looks like, right? Compared to last year. What does this look like compared to 2 years ago? What can we predict in the future of the state of this hospital? So knowing what they need to know and being able to provide that to them in one centralized system that connects every other software within the hospital has been essential for us.
Absolutely. And in terms of research, because this is what I do, this is really my line of work. In terms of research, once you got it, because you understood that you did field research, contextual research, so you actually went in the hospital, you spent times with them, you asked them questions. What surprised you? What assumption that you had about this product that actually was totally destroyed about what you've seen on the field?
I have to say the thing with me, I don't like assuming things. There's a saying, I'm from a Jamaican household. I don't know if you can say this here, but my mom, my grandmother would say, if you assume things, you make an ass out of you and me. So I try not to have so many assumptions.
You should have used the accent when you said it.
I don't want to embarrass myself. So apparently my accent isn't that great. I will see you maybe later on if you warm me up a bit, it might come out. But I went in with an open mind. When I go into a hospital, I forget what I know about the other hospitals because no hospitals are alike. They all face similar problems, but it's not the same causations.
Yeah.
Right? So I go into a hospital, forgetting the hospital I met yesterday, come here. I want to know you, clean slate. I don't assume anything. I go and say, okay, if you have a software using from 2000, that's okay. Let's see how we can assist you where you're at, right? We go in, no judgment, clean slate, open, transparent conversation. If I cannot help you, I cannot help you. And that's okay.
So your product is really custom to each hospital.
Yes.
In terms of productivity, how do you manage that? Like because it's like the product has to adapt to different contexts, different demographic, because some hospitals actually have a totally different demographic.
Yes.
So I'm just curious about how do you adapt the UI or even the dashboard that you build so you don't have to redo everything again? What are the core, basically, what
Yes.
are the core features that you keep that follows you everywhere?
We have a few core features. So we know that for the dashboard for the CEOs or the chief, it's always the same things they want to see. They want to see wait times, they want to see critical risk.
Yeah.
EDs, directors, similar. They want to see how many patients, how many staff, who's working overtime, who's been working for staff availability, beds available, similar information that we know that's the key. Or what we really change is our intake forms. For each hospital is different. Some hospitals, the older patients, they maybe want to use a diagram or the wording that's used, or sometimes they want certain like dialects in there that we can customize too. But our key features that we have are really staying there, and we have different features we've developed around that. And sometimes we just drag a feature and drop it, like just
Mm,
add them together in a package for them
mm,
that works for them. So we don't have to rebuild everything each
exactly.
time.
Mm.
What we really rebuild is the intake form and that process of what that looks like in the hospital.
Yeah, absolutely. And so actually that was a perfect transition because let's talk about the triage process now. So once the patient get to the triage process, what does it look like? Because I'm thinking about my experience going to the ER, to
Mhm.
emergency, and I first go through the triage, I sit down, then a clinician calls me. Actually, a nurse called me, a nurse practitioner calls me. I go in and then I wait for a doctor. Then, if my case needs a specialist, I see another clinician. So, how do you make sure that they all communicate through the process? So, but because I'm thinking you mentioned that that what ElleLogic is offering is has a superpower is real time data.
Yes.
So if I'm going to the ER and I have they took my vitals, they took everything, and now after the second doctor, how do I make sure that the second doctor have accurate information of what's going on with me and my body? Because I've been waiting in the waiting room for like 5 hours.
Exactly. And typically nowadays process, that doctor would ask you the same questions again and you will repeat your answers.
Absolutely, yeah.
And then longer times in the ER, more wait times.
Mm,
So for L Logic, our efforts is really shown at minute zero. When you go into the ER, you fill out our patient form, whether it's a QR code or some hospitals have a tablet or a kiosk, depends on the hospital you're in. You fill out our patient form, you put in your information, your numbers included. You're in Canada, we have our health card, we put that number. And that goes to the nurse.
mm-hmm,
On your end, you receive a message from us. If it's non-urgent and the hospital is an outpatient, we then direct you there. Say for the situation wise, you're in the ER. The nurse gets this information automatically on their system, right? Nowadays, all of nurses have computers or tablets they're working from, either
mm-hmm,
way, and they already have your information. Now, compared to now system where you go and pick a number and wait, and then you give this information, the nurse already has this information. She calls you to verify this information. If you're priority one, you get seen immediately. Priority two, you have to little wait for priority one. Priority
mm-hmm.
three, you wait for priority two and one, right? So it depends on where you are in the scope, but immediately that it reduces the wait time. When you see the nurses and they verify that information you input is accurate, that automatically gets sent to the doctor. So now when you see the doctor, you no longer need to answer repetitive questions.
Mm-hmm.
They already know the medication you're taking, why you're in, your medical history, your name, contact information, your age, things
Mm-hmm.
you're allergic to, medications that you're allergic to. Everything is there in full scope for them. So when you go into the problem, right?
I love that.
Yes.
Yeah. And how do you ensure what is your margin of error here? Because AI is providing information to the doctor. So based on what you said or what your medical record said. But we know there's a lot of mistake that could happen as well. So what is your margin of error in that sense? How do you ensure that the information that the doctor is looking at is actually accurate? And if it's not, how do they respond to these discrepancy?
100%. I want to be very clear with this. Our platform functions without AI.
Mm,
AI is just provides the real time effect.
real time fact.
And AI does not access patient confidential information.
Good to
AI
know.
does assess with the priority scale. So whether you're
Mm,
priority one, priority two, priority three, it's
mm,
de-identified and it comes back to our system. Then we re-identify it on our end, and then it goes to the doctor, right? So once you're in the doctor, that AI is no longer functionality there, right? It only happens immediately in the triage area. With a doctor, you're just using our platform. They have that information. They're seeing the notes are from prior visits and prior medical history. They're just having that access to information that is there already.
love that. So AI is actually just a tool for the triage part. That's
Exactly.
all. So we do not remove the decision making of the doctor,
No.
of the clinician. This is so good, so important, and this is something in you. And as a user experience design, that we always stress on companies that you need to keep decision
Yes.
at the center. And I always say something. I said use AI as a tool and not as your brain.
Exactly.
And it's important that doctors are able to overview the information and take themselves the decision.
Mhm.
And I think this is what is causing a lot of anxiety towards patient when they hear about AI being integrated in hospital environment or in healthcare environment. They think AI is going to take the decision
Yeah.
over the doctor. Thank you for sharing that. This is like definitely enlightening. And so based on now, how do patient? We're talking about how patient sees the. Have you been able to sit down with patient and ask them about how do they feel about this new process of being going through the triage?
Yes, we have sat down with many patients, whether from our
Mm,
customers' end or just random patients we've
mm,
asked to do our feedback sessions. And we have them go through the entire systems on our training sites where
mm,
they're in the ER, they fill out the information as accurate as possible and they go through the process. And they're very much thankful of it.
mm,
They see how it goes through faster. On our customer side, when we outroll for the first few weeks, I'm there myself, not my
mm.
team, me. I'm there on site. When a patient goes through, I ask the doctor or nurses if I can talk to them, like, what do you feel? What could be better? Would you feel about using it if it was faster? I get that on the ground review and feedback from them because that helps us to build better. One thing we have in mind in ElleLogic, we build alongside our users, doctors, clinicians, patients, everyone. We always have reoccurring active feedback sessions
Love that.
where you
Mm,
come test, not just our customers, but any doctor can
mhm.
come and test our platform. Any patient can come and test our platform. We want to have it open so that we're building with actual customers that uses our platform.
That's so good. And so based on the feedback, do you have any success stories that you can share about what they say, uh, how about the outcome and what they enjoy
Yes.
the most?
Yes, on the patient side, they like the connectivity of it
Mm-hmm.
all, where they have your history, they have everything there.
Yeah.
Obviously, in the testing side of the fake history, we
Mm-hmm.
don't actually populate their history on our end, right? We don't make sure our prioritization is accurate when we
Yeah.
do our testing. They do really appreciate that and what it could look like in a real life environment where they go to a hospital and they're using this. As on our testing side, on the doctor's side, they like, okay, everything is there. They see everything from the patient that's really there. The clinicians, the same thing. They're like, wow, now I don't need to ask every information because what I feedback I've received from nurses specifically is when they request medical history from a hospital the patient has been before, is not always answered immediately.
Mm-hmm.
Sometimes it takes days or weeks. It's a whole process, right? So, especially if you go from private to public or from province to province or from city to city, it does not follow you at all. And with ElleLogic, we can bridge that gap for them and provide that portal where you can transfer patient information more securely and in real time.
Yes, and also detect recurrency too,
Yes.
which is something that I have in mind right now that I want to ask you about this clientele that is elderly, that is maybe not so comfortable with technology, but are often going to the hospital,
Yes.
often are going through the system. How do you help them? How do you support them through this
Yes.
process?
With our system, we always have immediately in the front screen a need help button
Okay.
where we can have a clinician come over to help you fill out the patient
Mm,
form. Once again, our priority is to not replace clinician, but to support them.
yeah, absolutely.
And even the hospital now doing a patient form, a clinician helps you with that. So we're one freeing them up so they can give you more human contact and that human to human experience that you need in the
Yeah,
ER.
yeah.
And also we're also developing in the future a speak analysis where okay you can put in earpods or earphones and have
Mm,
us talk to you or possibly a diagram of the body and can touch where it hurts so it's more efficient for you.
love
We
that.
want to
Wow.
really cater for our community.
This is so good. So it breaks the barrier of language too, because they're
Yes.
actually able to point. Wow, this is so good. I'm so excited about what you're coming up with. And I just want people to know like, so far you made $1 million on one contract, and there's so many more things that are coming your way. And and I know that you're also targeting the Canadian market, but the US market
US.
as well.
Yes.
What is the difference between those two markets? What
Oh,
is the big thing that you've noticed?
I have to say hospitals are hospitals,
Mm-hmm.
right? Patients are the forefront of that. Canadian hospitals are ran mostly by government.
Mm-hmm.
Hospitals in the US are ran by
Yep.
entities, by companies,
Private. Mm-hmm.
right? So it's definitely a different perspective,
Mm-hmm.
but they both have their nuances. Or I don't want to burn any bridges, they're customers. But I don't, not to say I have anything negative to say, but it's a different market.
Mm-hmm.
You know, when you're fishing in a pond, it's different from fishing in the ocean.
Yes.
And the two markets have different pros and cons.
Mm.
The Canadian market, would say, is much smaller, so you get a lot of referrals. You get a lot of word of mouth. It's spread very quickly here.
Okay.
It's a small world. In the U.S., it's a bigger playing field. You
Mm.
work with one state, the other state doesn't know about you, right?
That's
So you
true.
go again, you start again, you build again,
Yeah.
and I love that. You know, I'm very resilient in that. I love to
Yeah.
go get my hands dirty in that sector. But I have to say, the US is a bigger ball game than the Canadian
Mm.
market that you can ever experience in healthcare specifically. And surprisingly, what surprised me most about healthcare is how underfunded and underrepresented it is in
Yeah.
both markets. And you would think for something that is so important, there would be more highlights on it to get
Mm.
it better. And everyone is throwing technology in healthcare, everyone is throwing AI, but are you actually fixing the root problem?
Wow. Oh my God. I'm about to close in just few minutes, but I really want to ask you this question. What is the big difference that you have noticed in terms of being a black woman and this environment of healthcare? Do you think that there's something specific towards how to cater the black community in healthcare that you think ElleLogic AI could actually really help with?
100%, especially as a Black female going to the
Mm-hmm.
hospital, we're less likely to take serious with our problems, with our
Mm.
pain. Having that accountability system that is there, you know, that I've been to this doctor, this is what they said. I've been to another doctor, this is what they said. Having that system of tracking with you without you having to go and search for it all the
Yeah.
time helps doctors to keep accountable. So that, okay, it's not just her word, but there's things that actually happened,
Yeah.
right? And it also tracks you too as a patient to say that, did you get the care you deserve? Did you go to a hospital and they did not treat you or you wanted to be treated? Now you have this here that you can do to get justice for yourself, to have your word out there. You know, we want to support Black women. We want to support everything, but also on the policy side, where ElleLogic comes in and we want to reform certain things, right?
Mm.
For hospitals now that didn't have certain knowledge about certain industries or certain demographics, we can now cater to them. If you know, okay, you're in this
Yeah.
geographical area and majority demographic is Black, but you don't know how to really tune for them because you might be maybe a new doctor, a new clinicians. Now you have a patient form that's there that
Data's.
can have that
Yeah.
information right there for you.
Absolutely. Wow. This is brilliant. I love that. I feel like you can go in so many directions with this
Yes.
product, which makes it even more innovative actually on the long run. Thank you so much. Thank you so much for sharing so much with us today. So where do you see ElleLogic going in the next three years, let's say? Because like I
Yeah.
said, you could go anywhere literally.
You know, I like to think I'm Batman and can conquer the
Yeah.
world.
That's it.
But, you know, in 5 years from now, 5 years, I have to say, Logic, I'm really specializing in emergency room.
Mm.
Knowing myself, I'm very much a go getter and I'm on the ground. Knowing my company, my team, we're very passionate about what we
Mm.
do. In 5 years, we want to be a reliable source for EDs, whether we're doing white papers on what it looks like in ED for patients and clinicians and everyone. We want to become really a source and a force to drive accountability, to drive ethical technology in ER, and really support clinicians and become a voice for them that not only there are solutions that can fix something, but the solution that can support you while doing it and not
Mm.
be additive work for you.
Love that. This is beautiful. Nice way to finishing that. And where my audience can find you? Are you on social media or you
I'm
share
at home.
everything?
I'm at
Are you at
home.
home?
I'm joking. I am on Instagram. I can't say I'm the most active poster
Mm-hmm.
and I can't say I'm the most responsive,
Mm.
but you can I'm on Instagram and mostly on LinkedIn. I'm probably more responsive on
Yes, absolutely.
LinkedIn. Danneelle Crisp, and on my company's website, actually, we believe in having direct contact.
Mm.
So you can actually book a meeting directly with me on my website on our
Yeah.
llogicai.com. Book a web meeting, come directly to my calendar, and there you go. You have more meetings. You can meet with me. You can see what we do. You can meet, ask about our company, where we want to go. If you want to do a feedback sessions, we're always open.
Yeah. Love that. Thank you so much. Thank you so much, everyone, for tuning in Thank you so much, Danielle, for being with me today. I promised you guys I would bring you amazing guests, those that really going to share the ins and out of their businesses and how you can also achieve building your own digital product. So stay tuned for another episode